Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today. Coming up later on, our famous roundtable, this time with Keith, Ogie, and Britt. Some controversial topics coming your way, lots of fireworks, so stay tuned for that. Between now and then, good information as well, plus a call for volunteers for an area hospice. So we'll get to all that, plus many more special guests in just a moment. But first, Jay Paul, our director, we can welcome back a guest who's been with us before. We always like to have him around anytime he can spare the time. Dr. James Anderson with Cornerstone Pediatrics at Premier. And today's topic is ADHD, and a lot of you remember to refer to it as ADD. But anyway, we welcome Dr. Anderson. How you doing, sir?
Doing well. Thank you for having me.
I commented off camera that he keeps looking younger every time he comes over here, which I guess, you know, it's because he's in pediatrics or something. That's, but anyway, you look great.
Well, thank you. I appreciate it.
Let's go ahead and do a definition for people who don't understand. They call it ADD, and some people call it ADHD. What is it?
ADHD is actually a situation where kids have difficulty with focusing and paying attention on what's going on, and it affects both them at school and it affects them at home. We all have a little bit of inattention and distractibility and some impulsivity, but it goes to the point that the kids are not able to function, and it limits their ability to have personal relationships and issues at school. So what we try to do is to try to identify that 3 to 5% of kids and try to see what we can do to kind of help them.
Well, let me ask you a combo question, which is it often misdiagnosed, or can it be misdiagnosed? Because you mentioned that all of us have some tendencies. And how do you diagnose it? So attack those.
That's a great question. Yes, it can be misdiagnosed. The main reason it is because a lot of times some of these things can be behavioral. And a lot of times these kids don't require medication, but they need to sit down and have some, with the parents, have some parenting skills to kind of teach actions and consequences and help the kids to learn how to be responsible for their actions. So one of the things you want to do in your evaluation is to make sure you get a good assessment of the parenting skills of the parents. With respect to diagnosis, what we do is we do a couple things. First of all, we sit down, we send them some information, we call them the Vanderbilt studies, but basically there's information we get from the school, from the parents that they fill out beforehand. We look at their history to make sure there's not a medical reason for things going on, or maybe a genetic reason that the kids are having some problems. We assess all of that, and if it does look like the child has ADD, then we make an appointment for the kids, and we actually sit down with them for about 45 minutes to an hour to go over that, talk about what is ADD, and see if the child really does have that diagnosis.
Would you sit down? I know we didn't rehearse this. I'm just interested. Would you sit down with the parent present, depending on the age of the child, or just with the child when you do the
That's a great question. Actually, we typically do it with the parents. Now, we have some kids that may be older, like middle school age or high school age, and those usually kids are more inattentive. And in those situations, we invite the kids to come.
If left untreated, what does this do in terms of the student's ability to, the child's ability to be a good student, and just in his or her own personal relationship?
Well, a lot of times the kids will end up struggling. And what happens is that if they're acting impulsively or they're not thinking about what they say, that can affect their relationships with their friends, because they just, like I said, they respond impulsively and don't really, as my grandmother used to say, they don't think before they leave.
Right.
It can lead to frustrations in school. They may be academically very bright, but they're placed because for behavioral reasons and the like in situations where they are not quite at grade level where they're being challenged. Then they get bored, and it makes things a whole lot worse.
Another two-parter real quick before we run out of time. What are the traditional treatments for ADHD, and what are some new things you can offer?
Great question. First thing is, obviously, medication is the mainstay of treatment for ADD. They're the stimulant medications like we had when we were growing up. The good news is these medications are still tried and true, but we now have new delivery systems, so that really we can only give them once a day. They're capsules that can be sprinkled if the kids can't swallow pills. They're patches that we can use for the kids. So the stimulant medications themselves that are good and tried and true are much more safe and much more easily tolerated than they were years ago. There are non-stimulant medications now too. There's two, one called Intuitive and another one called Triad, that offer maybe not necessarily quite as efficacious of a management of ADD, but I've had a lot of patients who've had concerns of side effects from stimulants that have done extremely well on the non-stimulant medications.
And those two medicines, get a plug for them again?
It's Triad and Intuitive are the two brand names.
And the pediatrician would be able to prescribe this if indicated.
That's correct.
Let me, a couple things I want to do. One is to put up the Cornerstone website. And Pam Goldberg is in the studio. You can't see her, but if I get this wrong, she's going to yell at me, and so I'm going to try to get it right. But it's www.cornerstonehealth.com. Got it right. She's got a thumbs up on that. But the other thing I want to do is, do you want to get a plug-in for like a website or a phone number for your practice or anything?
Yeah, we're Cornerstone Pediatrics at Premier, and our telephone number is 802-2200. We're open Monday through Friday from 8:30 to 6, and on Saturdays and Sundays we have weekend hours for urgent care. Phones open up about a half hour before the practice does.
Thank you so much. Come back again, will you?
Absolutely, we'll be glad to.
Always a pleasure.
Thank you
Doc.
for having me.
All right. We'll be right back.